Good evening, everyone. This is Tim Ashe, President of the Vermont State Senate. Thanks for joining me for my daily update on April 27th. We're now about 6+ weeks into the COVID-19, what's become a new normal for many of us. The situation, as I've described in previous updates, in some ways is much better than other states, I believe, because of the tough or stringent measures we put into place, guided by science and our public health experts. I also want to say over the course of the last 3 days, there's been about 20 additional positive tests for COVID-19. So while we are making progress suppressing the spread of this infection, it is not done. There are still about 30 to 35 people who are hospitalized, which is down about 50% from what the peak amount was on a given day. So that's also good news, except that does mean that 35 people are hospitalized. And we know that if you're hospitalized, it means that your symptoms are very, very serious indeed and very worrying. Second thing, as you know, I have been beating the drum with the governor and his team to significantly increase the resources available to take phone calls and work through problems for people applying for unemployment assistance or the new program for self-employed and independent contractors. While some additional resources have been brought to bear, and that's good news, I do hope people will email me directly if you're continuing to have problems so that I get a real world check on how things are going for the actual human being who needs help very badly. Before I turn to tonight's guest, just want to say that last week I had the governor on with me. You can go to my Facebook page and see that video. And then the next night I had Peg Gagne, who's the chief nursing officer at UVM Medical Center. Both of them were providing sort of the human element of their respective positions, with the governor, what it's like to have to make some of these really difficult decisions, how he went about making those decisions, and for the chief nursing officer, Peg Gagne, talking about what life has been like for nurses on the front line of fighting COVID-19. For people watching outside of the Chittenden County area, Chittenden County has obviously been the hardest hit of all the counties in the state by far. And so the nurses at UVM Medical Center are have had more cases than any other facility in the state. So I've really appreciated them. Tonight, we're very fortunate to have Rob Meehan, who's the Director of Feeding Chittenden, which used to be referred to as the Chittenden Emergency Food Shelf. So thanks, Rob, for joining me.
Thanks, Tim. It's great to see you.
Rob and I were former co-workers at Champlain Valley Office of Economic Opportunity back in the day, as they say, in a different role than he is now. Rob, how long have you been the director of what we have in shorthand called the Food Shelf?
Since 07.
All right, yeah. 13 years. Yeah, wow. Yeah. Time flies.
Yeah.
So before we get into talking about how COVID-19 has impacted Feeding Chittenden in terms of volume and the severity of the need, before COVID-19 came along, just give people who are less familiar with the human services universe that you and I have both inhabited, tell people what a day in the life looks like at Feeding Chittenden under normal times.
Sure. So at 228 North Winooski in Burlington, we have a congregate meal site, so people come and enjoy a meal together in a cafeteria. There's also a grocery store that we painted up nice with some nice shelves. People come and get groceries, and we have a culinary job training program on site that's a partnership with the Vermont Food Bank, and we work with people. A big part of our job, as you know, Tim, is to try to engage with the people that we serve, and Community Kitchen Academy allows us to do that. So we make food together that would otherwise be wasted, and we get that out to people in a variety of ways. We have a homebound delivery program, so we deliver groceries to people throughout the county. We also have a food truck that goes out in the community and serves up eclectic street food that's locally sourced. So it's pretty vibrant, community-based center right there in Burlington.
Don't listen to the cat crashing things in the background. It must be mealtime. This is the hazards of live TV, I guess.
Great.
So About over the course of a typical week, what would be the number of individuals that you serve, unique people?
Yeah, it depends, Tim, because there's so many different programs that I just described. But, you know, in the grocery store, where we serve anywhere from 11,000 to 12,000 people in a year's time. It depends on the time of year and time of month to see how many people are coming through. Some days during, November peak month where you're seeing Thanksgiving, et cetera, and people are coming in from the cold, we'll have as many as 600 people in our supermarket in a day. Normal day, it's more like 300 that are coming for groceries. It's the largest of its kind in Vermont, just by where we're based. And it's a lot of food that we move. We move about 2 million pounds of food through that building in Burlington in a year.
That's unbelievable, the amount of need out there, and then how much you're able to meet that need. And I know you're always sort of scrambling to come up with the resources to address it, but how critical it is. So sorry to make an abrupt switch, but you painted the picture of pre-COVID-19 feeding Chittenden, and wondering when did you start noticing things changing as a result of the various public health measures and
Sure.
the economic impacts that have come with it?
Well, we were we made an aggressive change, Tim, and around the 9th of March, we had a meeting and we immediately changed our services to being takeout and to go. So we stopped having people congregate. Our meals were now handed out the door. We had groceries starting to be pre-boxed, pre-bagged, and handed out as well. So we jumped right on that. We listened to the World Health Organization and the CDC before really listening to anyone else, and said, we better try to make sure we can stay open. And still remains a goal if one of our team members is to become sick or a volunteer, we'll have to close for a good amount of time. So yeah, we changed dramatically overnight.
And you were making those changes before the state of emergency in Vermont was declared, it sounds like, which I think 2 weeks, maybe 2 weeks later than that.
Yeah, I remember on the 16th being a very different looking organization, and still are today. And so basically what we're doing now is we took on a new program in response to a lot of the temporary housing voucher program in our area. There's a lot of people that are homeless that are staying in motels and hotels. And the homeless healthcare community kind of approached us and said, can you help with meals? And our culinary job training program quickly turned into an emergency meal delivery program. And that involved a lot of organizations' help. So our chef and 2 of his graduates have been making, right now it's up to over 1,300 meals a day that are being delivered throughout Chittenden County to 14 different sites. And COTS is coming to pick up food as well. But there's been so many heroes amongst this program of drivers that are volunteering their time, spectrum workers, community health center workers, Howard Center, street outreach workers, COTS workers. It's incredible, all the people that have come forward to help move food around, and also have the service provider on site at the motels to work with people who are staying in those temporary housing situations. So that was a big change.
So 1,300 meals being distributed a day.
Yeah. Yeah.
And your normal operations for your homebound delivery program would be a fraction of that, I'm assuming. What would be the typical amount of food how many meals a day would you typically be distributing if it weren't for this crisis?
Well, we see about 150 people in our soup kitchen in a morning. So, you're looking at a much smaller number there of meals per day. Also, we have people coming on site to pick up meals in the morning, and that number is around 60 right now a day. So in addition to those meals that are being delivered, we're also handing meals out. The groceries are what we deliver to people who are homebound, and that number also has jumped up. It was around 150. It's now getting closer to 250. So that requires volunteers to move groceries out for people who are sick, as you mentioned, but also people who are homebound, have mobility impairments, and can't get out to charitable food places like ours.
How much of the increased activity that you've just described is finding new ways to get meals to people who already were utilizing various programs and services around the county versus people who are newly in need because they've lost, their jobs or substantially lost their income. Do you have a sense of that?
Well, both is happening. So for example, people who are displaced workers are coming right to the door to pick up groceries, but some are also calling who are afraid to go out. And, a lot of people that are in sort of that target category at risk, we're delivering food to those who are new, never asked for help with charitable food. And with meals, the same thing. So you're seeing people that are, homebound because of the pandemic, and meals are going to them too. So we saw a 38% increase in our supermarket in the first 2 weeks. And that included people that were out of work from, local department stores, and obviously the restaurant workers and bars and other places where people can't go to work. It's super sad, but it's great that the community has come together, like I described, with all those sister nonprofits working hand in hand. So it's pretty great.
When under normal times, there's a stigma that has historically been attached, which prevents some people from seeking the help that they need. And I know that, I've talked to people who work at local community food shelves and church-based food shelves over the years, and they'll talk about people who come in sort of after hours or, trying to not be detected by neighbors or other community members because they don't see themselves as the kind of people who need support. Have you found anything, has there been a different approach now in light of the fact that for many people, they're out of work because of this larger, calamity that's taken over our economy? Have you seen people showing up, not only that wouldn't normally be coming to Feeding Chittenden, but with a different sort of attitude or sense of what it means that they're at your door seeking food assistance?
Oh, sure. And there is a stigma still attached with accepting help, but I do think during a pandemic, a lot of that is put aside. Good. And that's a great thing for us, because we really don't want to be a place that people are ashamed about. We really want to be a place that's a community organization where everyone feels it's theirs, and we don't receive government money. So we really are a community organization where, although, while we do are under an umbrella of an organization that does receive federal dollars, we actually don't in our program. A lot of people don't know that, but we kind of pride ourselves on trying to address the issue that's stigma and try to create a space of dignity and respect for everyone.
Have you had any of your own staff had to leave work either because of a positive test or contact with individuals who they suspected might be a positive test? And have you had any clients who you're aware of have contracted COVID-19?
Yes, with staff, we've had people that have had to quarantine themselves with worry of knowing people who have had it. We've had many clients that we're delivering to their houses who have COVID-19. That's was for a couple of weeks a common occurrence, and those are phone calls that we're receiving in that list of additional and new clients. So
what the term frontline worker in some ways is very aptly used to describe the people who work with you. Would that be a fair statement? Not to give you a leading question, but.
No, I mean, I do. I'm proud of the people that I work with. They're answering a call that is pretty great. And you can say the same for a lot of others too, but I just care about my guys. So they're not only showing up early and making meals, and they're the warehouse worker that's jumping in the car and taking food to the person who has just called. They're the fundraiser person who's jumping in the car to drive food somewhere else. It's incredible what people are doing. It's an amazing staff, and they've been there for a long time. Like when there isn't a pandemic, they're still meeting people who believe that their lives are not going great and that there is a crisis of sorts based on trauma. And so they're special people to begin with. And it's not surprising to see them shine when they need to. You know, not to sound political with you as the leader of our senator.
Go ahead, it's my life.
It's interesting to see the onus that was once on government shift to charitable food, and that our safety net of sorts becomes charity when once it was government. And I'm not trying to get on a soapbox, but rather say we saw that really come to light during this pandemic, nationwide, but definitely here at home.
Well, I think the philosophical questions, I shouldn't even call them philosophical, but the sort of core questions about what has value, what kind of work has value, I think have really been confronted Americans in a way that they haven't been forced to confront in a while. Typically in times of crisis, the people that we associate with that are firefighters, police, first responders, medical professionals, all of which is totally appropriate. It's far less likely that we think of people who are working, providing food assistance to people who are in need as frontline workers of the way we think about first responders. And it also raises, broad kind of economic equity questions. Right now there are people who have to show up for work in relatively low paying jobs in retail or in supermarkets and grocery. They do not have a path to collect unemployment assistance under the new federal program or anything. So they have to go to work, and they're doing so at risk to themselves because of the constant interaction with the public. And I think, I should say, I hope that when we get on the other side of this, people will reevaluate whether they think that the type of pay that has been associated with some of these positions is appropriate anymore. And I think the work that your coworkers do, I suspect, maybe you're going to tell me that I'm wrong. I don't think anyone's getting rich working at Feeding Chittenden. Am I right?
I think you're correct. That's a correct statement.
All right. Yeah. You don't have to tell me how bad it is, but I know that people aren't getting rich working at Feeding Chittenden. So it does raise these bigger questions about how it is that we value the work that people do. How have you, I know that when this virus first started hitting Vermont, many people and many people quickly became out of work. There was a lot of interest in volunteering. Feeding Chittenden has volunteers over the course of a normal year. What has your interaction been like with people who have come out of the woodworks over the last 2 months saying, I want to help, tell me what I can do? Have you had a lot of people stepping forward? Have you been able to utilize them? What's that been like?
Sure. It's been an incredible response from the community, both with volunteer requests as well as donations. It's been amazing to see people come forward and really value hunger relief work and want to participate. And we absolutely have tried to accommodate people. Right now, it's been challenging, Senator, because we're social distancing and trying to keep a limited number of people in a space at a time. And so there's been a lot of thank yous, but we really can't use you right now, which is a hard thing to do. We are utilizing volunteers as drivers a lot because that has become a big part of our business, is driving food to those who can't come to us. And we're hoping to mobilize people in other ways to try to help educate and kind of mobilize people around issues of hunger and poverty, and see if people can learn more about why does hunger exist in the first place, and what are things we can do to kind of turn that in another direction.
So if right now someone's watching and they say, well, gosh, I'd like to help, Chittenden Emergency Food Shelf, now Feeding Chittenden, I've always been interested in what they do. I really care about meeting the needs of my neighbors. I want to help. What is the best thing that they could do right now in light of the challenges you have with social distancing and all the other changes in operations? What is the single best way you would recommend someone help?
Yeah, the best way people can help is with financial donations. For example, the team I described with our chef and with our 2 assistant chefs, there's no budget for those. And the meal program of 1,300, it's actually closer to 14 now, a day. It costs for packaging supplies, it costs for the delivery of the food and the staff that's, by which I mean purchasing the food, delivering it to the site to be cooked, warehousing the food. Like, there's a lot of costs associated with a meal program we just didn't have, we still don't have. So we're trying to backfill this work that we just said, yes, we'll do it. Unfortunately, that's kind of our whole business, is trying to help be a foundation for nutrition in the largest county and most diverse in the state on basically a shoestring budget, understaffed, often underappreciated, meaning the staff. And as we see now, doing really critical, vital work for a population that unfortunately is growing. We've seen a lot of our mental health services funds shift in the last 10 years. So you're seeing a lot more people in need of service provider attention. So, this is when you talk about philosophical, a question that we talk about a lot through my history of working in Hunger Relief about why do we have food pantries? Why can't we just put all the food in the supermarket? There's still a great need for service providers, for people to work, to help people with job training, to help people get links to housing, to healthcare. There's still a great need for that. Unfortunately, a great need, Tim. But if I had my druthers, I would be putting more money into the food stamp program and making it more accessible and available to people so that we could build our local economies and that people could have the nutrition they need.
Yeah, I think, when some political discussions around food stamps, often at the national level, it almost misses the point, which is, do you want people to be able to build towards self-sufficiency in their lives or not? And having them be deprived of nutrition is not the foundation for being able to move forward with a successful, self-sufficient life. And so if individuals' basic needs are not met, the way they present to the community is not good. It will present in other ways in terms of malnutrition, mental health challenges, you name it. All of that is going to have to be dealt with either by a hospital, a police department, schools, you name it. So it's really a matter of how we help people, not whether we're going to. And we can either do it a humane and positive way or the inhumane and negative way by neglect. But one way or the other, there will be an expense. It's just a matter of whether it's a positive expense or a negative one. That's how I sort of have distilled it in my mind.
Right on. I mean, that deserves a right on. But I think the reason that you hear us asking for money so much is it does cost a lot and we aren't receiving those funds, and it is critical work. It's sort of this cycle of asking. It's not an easy thing to do, to continue to say, can you please support us, community, when we actually might believe that your tax dollars should go to monies that would support work like ours to begin with. Hopefully, as we talk about innovation through the pandemic, you mentioned earlier ways that we can address the stigma, promote dignity through maybe changes in how charitable food works. Maybe we're gonna see some of discrimination and type classism impacts lessen. Wouldn't that be great? And we would see some changes that could move more food to more people too. So we're seeing this in other fields. I would think charitable food may follow.
Well, we've got time for one more question. So you've described a lot of above and beyond kind of work by the people at Feeding Chittenden, coordination on like a whole nother level of all the partner organizations who people maybe take for granted how much it takes to come together to be able to serve 1,300 meals distributed all over a county, plus the in-person packaging, all that stuff. Are there any particular moments looking back at the last 2 months that stand out where you thought to yourself, wow, like my team is really stepping up. This is amazing what they've just pulled off. Like have there been standout moments even at a time where you're commending them in general for a higher level of performance?
Yeah, I mean, even with our partners, I mentioned some of the nonprofits that make you say, wow, this is really cool. So you start to think all these sister nonprofits that we sort of siloed off and do our own thing, you're starting to see the importance of our network, just in Chittenden County, but also with our Vermont Food Bank that's been outstanding leader throughout this, as well as Hunger Free that's helping in their way as well. It's just a phenomenal network. On staff, you know, you see our chef who changed from being a teacher in 48 hours, had an emergency meal program up and running that was helping people that, you know, were just finding themselves in a situation and all of a sudden in a motel with no food and with no understanding of how they were going to get that. And then you see our annual fund manager putting together a spreadsheet that includes 14 sites with, I don't know, something like 20 different drivers and coordinating this effort. Like she had been a dispatcher her whole life of drivers at a taxi service or something. Pretty incredible. And then you see the community coming together asking, can I volunteer? Can I donate? How can I help? You see the people who are a custodian on site who says, can I help fill bags? And can I help make sure that we get it all out? Because there's not enough people on staff today, or the volunteer coordinator who's trying to answer every single request. You know, the warehouse worker who stops what he's doing because the person who's sick needs food and there's nobody left and it's Friday and it's 4:30 and he drives the food to Winooski to get it to a family that's got a person in quarantine. Like the stories there's so many, it's unbelievable. It's hard not to include the community of donors and volunteers in that, just to say thank you. And the gratitude it's flowing with our team right now.
Well, it's a pretty amazing accomplishment that you guys have been able to step up in such short order and meet all these additional needs. And my hope is that some of the people watching will contribute to Feeding Chittenden and also contemplate doing that even when we're on the other side of this crisis, because one of the things that happens is we often see a spike in resources coming to an organization like Feeding Chittenden. But then when things return to normal, we kind of forget that there are still people out there in great need, and there are still people out there trying to meet that need. So if you give now, hopefully you can continue to give in the days ahead. And Rob, thanks for joining me. And on behalf of the Vermont Senate, thank you so much. I know that there are partner agencies throughout the state who are also meeting people's nutrition these really awful times, but hope you'll thank your whole staff on behalf of the Vermont Senate. We're just totally inspired and grateful for what you're doing. With that, I'm gonna wrap for today. Tomorrow, I'm gonna have Commissioner Mike Pieciak join me. Mike Pieciak is maybe not a household name. He's the Commissioner of Financial Regulation, which is normally maybe something that a title that would make people snooze a little bit. However, he has been designated with being the chief modeling person for the state's COVID-19 response, which is to say he's been looking at all the projected number of cases, the need for ICU beds, and helping inform all of the different adjustments to the state of emergency order. So he has been crunching the numbers so that Vermont's response can be based on the science. And so I really look forward to hearing Mike's take on what it's been like, what the scary moments were when, and some of the adjustments we've been able to make based on things that he's been finding with his projections. So hopefully you'll join me tomorrow at 5:30, and I hope you all continue to stay safe.